Dennis Donavan. For those of you who don't know me, I'm a physical therapist down in the Palm Beach, Florida area. When I was sent the promo for this month's webinar, thinking about making Winback our first choice, it got me thinking about, kind of where I start some of my patients, early loading with some tendinopathies and stuff like that. So I have a couple really good videos I'm excited to share. Ready, the first one. I'll just give you guys a quick little background. So the first video is gentleman who's a big golfer. I see a lot of golfers naturally in the Palm Beach, Florida area. He was playing a lot. He developed a bicipital tendonitis type of issue, impingement type of symptoms. So he was coming in a lot of pain, and it was something that had been bothering him for several months. He had come down for the season. It was giving him a hard time. He tried to take some time off, and it just nothing was really helping him. Even very gentle isometrics against my resistance was painful for him. So I'm going to share my screen now. So what we did was I strapped the Winback to him. Can you guys see my screen there?
Yes.
Okay. And whoops, that's not the right video. Okay. So basically what I have in this setup is he's looking at this screen. I'm gonna play it for you guys. Volume so I can talk over it. He's looking at this screen, and that screen is giving him feedback as to how much force he's producing. We messed around with different angles. I'll pause for the parameters there. Messed around with different angles, but what we found was that being able to contract the tendon, load the tendon under the frequency of the bicep made it, one, much more comfortable for him, and two, allowed him to produce greater force output. So we started at about 90 degrees of an isometric contraction. You see I'm working at 40% heat. I have the high tens at a 5 hertz for a little bit of pain modulation as well. And we did this for probably about, a week or 2 weeks. Let me play that for you guys one more time. Before we started progressing to different angles. So again, he's contracting the bicep. You can't really see it, but he's at about 90 degrees of bend there. Just again, slowly starting to load the tendon. And when we started doing this, this is when he was able to actually get a good contraction without any discomfort. So that's again one of my favorite things about using the Winback device is I'm able to allow people to move, perform, muscle activation that was previously painful without discomfort. It goes back to what Dr. Tucker was talking about how we're really able to modulate pain through several different mechanisms. That the Winback's able to provide. So I'm just gonna stop my share for a second, show you guys the other one where we change the angle around. And so now you guys will get a better view. Whoop. So this is where he's almost like in a more fully extended position, but again, working to slowly load the bicep. Again, very similar parameters to what we had been using. So again, I'm able to get a great concentration of current in the tissue where I'm looking to target. So anyone who's heard me talk on these calls, I love using the Takar therapy actively. My first choice, obviously, when we start getting these, patients who need to load the tendon very slowly, symptoms are very irritable. This is like such a key for me because people use it and then all of a sudden, patients buy in very quickly because they're like, wait, now all of a sudden I can move that or contract that tissue without any discomfort. Play that video for you guys one more time. So again, I have the ground, the disperser. I'm using two adhesives here. One is wrapped under that blue pad. The adhesive had kind of lost its stick. So rather than busting out a new one, I just wrapped it for him. And then I have the other kind of over the scapular area. So I'm getting that current flowing from the scapula through the shoulder blade towards the forearm, really making sure that I'm not missing any portion of the bicep. And that's my goal with that. When we think about the Winback, it's important to remember that we can influence where the current is going by altering the resistance of the tissue in the chain. So here we're getting that bicep activated, and with that, we're getting a concentration of current exactly in the tissue we want it to go to, right? I have another video I'd like to share with you guys. 1 second here. So share again. So this was a really cool case for me, not cool for the gentleman. This was a man who had had a total knee replacement, and unfortunately, can you guys see that video there?
Yes.
Okay. Unfortunately, suffered a fall. He had been coming down to Florida for a month. Slipped on a throw rug in his rental property. Very unfortunate. It's really jarred the knee, kind of ballooned up. And where he had previously achieved about 120, 122 degrees of knee flexion, after the injury, he went to the doctor, x-rayed. There was no structural damage to the artificial joint, but the knee was stiff, very, very stiff. So he came into me with about a 12-degree extension lag, only getting to about 92, 93 degrees of bend. Through using the Takar, and I modulated the current, as we took him through this over 4 weeks, we were able to get him bending much better. So this is another setup I really like. We're getting like an active assisted stretch. So again, I have the applicator using an adhesive over the thigh, that current traveling through the knee joint towards the disperser, which I have on the calf. So again, similar to the principles we're talking about with the bicep tendon, I'm getting a concentration of current in the tissue that I wanted to. Now, this I was performing on the back 3 device, so I just want to talk about the settings I was using there. Because what I was trying to do was get a blast of current into that fibrotic tissue, right? So this was much later on. This was his last week with me, when we were dealing with a more acute, more edema in the knee joint. I wasn't working as high. So you see here I have the super pulse setting check that's going to give that blast of current up 30%. And again, that's really helpful with vascularization and collagen synthesis, which again felt was super important for this gentleman. After 4 weeks, we got him bending to 117 degrees, and he was able to extend, missing 3, 4 degrees. So he was able to make a lot of progress. Felt really good, and he even said to me, "I'm not sure I would have been able to, get this far without, utilizing the Winback." He felt it was super integral for restoring some of the range of motion he had lost following the fall. I believe I have one more to share with you guys. So that's not it. Give me 1 second. Okay, so this is my last one. And as I was saying, I like to, because I work with a lot of golfers in Florida. One of my biggest things with these guys is trying to improve thoracic rotation as well as hip rotation, right? Trying to foster stabilization of the lumbar spine while getting them to rotate their hips and thoracic spine around that stable segment. I love using this setup here, which I employ with a little bit of cupping. So this is a very passive setup. And what I do is, and I don't have a video of this, but prior to the activation prior to using the cups, I'm using the capacitive current, working in the 40 to 50% range all through the paraspinal thoracic spine tissue. And then from there, I leave the cups on. I like to draw a little bit more focused current through, again, the paraspinal muscles, just while that current is running, doing its thing. So again, we're influencing tissue resistance here with the cups, and we're just helping to improve some mobility. So I use this as almost like a warm-up, basically. You see here, I'll pause on the parameters. So again, working at a pretty high level of heat, 50%. I'm toggling between resistive and RET plus, trying to get all that tissue, the bony tissue, ligamentous tissue, as well as the resistive tissue. And then from here, play this one more time. really get a nice warm up for the back before we start trying to mobilize that tissue. So I love to follow this type of stuff up with thoracic spine mobility work, resisted rotation work, stuff like that. It's going to allow him to, actually move his body to meet the demands of the golf swing. And that is all I have to share. Thank you for listening.
Well done. That was a lot of fun to watch all of those. Dennis, can you just share what the total knee replacement gentleman's like? Take me back a little bit. Like what did you do in the first few minutes with him, and then what did you do at the ending with him?
Yeah.
To get him to be able to be, using the liable bar with his involved knee, elevated.
Yeah, so I only had about 6 weeks with him, so I was trying to, get as much, bang for my buck as I could before he went back north. But he came in maybe like 13 days after the fall. The knee was still very swollen. So I didn't want to put a whole lot of heat through that at first. So I was working a lot with the capacitive current at a low level of heat, trying to promote oxygenation, circulation of fluid, a lot of effleurage, using compression boots, stuff like that. Try and flush out the swelling, get the knee to contract a little better. Really anything to try and wake back up his quad, which I felt like had lost some of its activation. From there, we then transitioned into a little more active work. Once I felt like we were able to get some of the initial swelling down, I felt more comfortable taking up the level of heat, better, making us better able to promote vascularization, soft tissue relaxation, and stuff like that. So I would say for the first 2 to 3 sessions I was with him, it was all about inflammation control, still utilizing the Takar therapy, but trying to stimulate the more lymphatic tissue with the capacitive current to again promote microcirculation and oxygenation. Once the swelling was under control, that's when we really started to try and push that range of motion. So a lot of ranging the knee with the current running through different ways. With me doing it, with him doing low load, long duration stretching, with the active assisted stuff like I was showing you guys in the video. And we just keep kind of ramping that activity level up. Over the 6 weeks I had him working with me.
Good job. Really well done. Thank you so much.
Thanks for listening, guys.
Yeah. And Dr. DeFabio